Hello, we are going to talk about the carotid artery. Overview. The common carotid, internal carotid and external carotid arteries provide the major source of blood to the head and neck. Additional arteries arise from branches of the subclavian artery, particularly the vertebral artery. The common internal and external carotid arteries and accompanying veins and nerves all lie in a cleft that is bound posteriorly by the transverse processes of cervical vertebrae and attaches muscles, medially by the trachea, esophagus, thyroid gland, larynx, and pharyngeal constrictors, and anterolaterally by sternocleidomastoid muscle. The common and internal carotid arteries lie within the carotid sheath, accompanied by the internal jugular vein and the vagus nerve. Common carotid artery. The common carotid arteries differ on the right and left sides with respect to their origins. On the right, the common carotid arises from the brachiocephalic artery as it passes behind the sternoclavicular joint. On the left, the common carotid artery comes directly from the arc of the aorta in the superior mediastinum. The right common carotid has therefore only a cervical part, whereas the left common carotid has cervical and thoracic parts.
الترمينال برانشز بتاعته عبارة عن 3 فروع. الأكبر واحد فيهم اللي أنا بعتبره الدايركت كونتينيويشن للكومن كاروتيد اللي هو ده الإكسترنال كاروتيد أرتري، وطالع منه اللينجوفيشيال أرتري اللي هو بيكمل معانا هو اللينجوفيشيال ويدي اللينجوال والفيشيال. السكند برانش من الترمينال برانشز اللي هو الانترنال كاروتيد، الفرع ده الانترنال كاروتيد أرتري اهوت اللي في النص، والانترنال كاروتيد بيطلع ستريت على طول الى البرين، يعدي من الكاروتيد نوتش عشان يغذي البرين. وهنا في البدايه بتاع الانترنال كاروتيد بلاقي فيه الكاروتيد ساينس اللي هو الدايلاتيشن ده، وعندي الفرع الثالث اللي هو الاوكسيبيتال ارتري وجنبيه الاوكسيبيتال فين. الاوكسيبيتال بيطلع الاول ويليه الانترنال كاروتيد، وهنا في عندي عصب جاي من الجلوسوفرنجيال رايح للكاروتيد ساينس. هنا لو حسينا ممكن نحس الانتر كاروتيد بون او انتر كاروتيد كارتليج موجوده هنا نوديول صغيره.
External carotid artery. The external carotid artery begins lateral to the upper border of the thyroid cartilage, level with the intervertebral disc between the third and fourth cervical vertebrae. A little curved and with a gentle spiral, it first ascends slightly forwards and then inclines backwards and a little laterally to pass midway between the tip of the mastoid process and the angle of the mandible. In the substance of the parotid gland behind the neck of the mandible, it divides into its terminal branches, the superficial temporal and maxillary arteries. As it ascends, it gives off several large branches and diminishes rapidly in caliber. At its origins, it is in the carotid triangle and lies anteromedially to the internal carotid artery. Internal carotid artery. The internal carotid artery supplies most of the ipsilateral cerebral hemisphere, eye, and accessory organs, forehead, and in part the nose. From its origin at the carotid bifurcation, where it usually has a carotid sinus, it ascends in front of the transverse processes of the upper three cervical vertebrae to the inferior aperture of the carotid canal in the petrous part of the temporal bone. Carotid sinus and carotid body. The common carotid artery shows two specialized organs near its bifurcation, the carotid sinus and the carotid body. They relay information concerning the pressure and chemical composition of the arterial blood, respectively, and are innervated principally by carotid branches of the glossopharyngeal nerve, with small contributions from the cervical sympathetic trunk and the vagus nerve.
Hello and welcome to another episode of Interactive Biology TV, where we're making biology fun. My name is Leslie Samuel, and in this episode 57, I'm going to talk about pressure reflexes and mean arterial pressure. We've been talking about mean arterial pressure a lot. We've spoken about cardiac output and peripheral resistance. You can always revisit previous episodes to find out more about that. So today we are talking about pressure reflexes. And we'll look exactly at why we call it pressure reflexes. But here we have the heart, and I feel like I keep saying that in every episode recently. And the heart pumps the blood throughout the body. We have the aorta, and one of the arteries that I have not been talking a lot about would be the carotid artery. So this is the common carotid. And so I'm just going to come here and draw a line here and say that we're dealing with carotid arteries. And of course here we are dealing with the aorta. Now there is something very special that we have in these two arteries. In both the aortic and the carotid bodies, we have receptors that we call baroreceptors. Now from the time you hear the prefix baro, you should know that it has something to do with pressure. For example, a barometer measures pressure, and here we have baroreceptors, and these baroreceptors respond to changes in, you guessed it, pressure. And that's why they're called baroreceptors. Now, what's going to happen is if we have an increase in mean arterial pressure, so we have a significant increase in mean arterial pressure, what that's going to do, these baroreceptors are going to start firing. So we're going to have an increase in the firing of these baroreceptors. In other words, they're going to be sending signals. And those signals are going to go to a region of the brain, in the brain stem, that we call the medulla. The medulla, and this is known as the blood pressure regulating center. Of course, it regulates other things, but it also regulates blood pressure. That then is going to cause, let's draw this arrow coming in this direction. It's going to cause a combination of two things. It's going to cause an increase in parasympathetic activity, and it's going to cause naturally a decrease in sympathetic activity. Now, if you remember from one of the early episodes, sympathetic activity causes stuff like increasing heart rate, increasing blood pressure, and so on. Parasympathetic activity calms stuff down, so it reduces blood pressure, it reduces heart rate, breathing rate, and so on. So we have an increase in mean arterial pressure, so an increase in blood pressure. The baroreceptors are going to respond by sending signals to the medulla, and that's going to cause an increase in parasympathetic activity, calming stuff down, and a decrease in sympathetic activity. Sympathetic activity would normally increase pressure and speed stuff up, but here we're slowing that down. So the net result of these two things is we're going to get a reduction in cardiac output and also in peripheral resistance. And then, of course, that is going to cause a reduction in mean arterial pressure. And this is why we call it a reflex, because we have an increase in mean arterial pressure, and that's going to cause a number of things that's going to eventually cause a reduction in mean arterial pressure. And of course, the relationship between these quantities here, we've looked at a number of times. And just to revisit that, MAP is equal to CO times PR. Mean arterial pressure is equal to cardiac output times peripheral resistance. And since we're decreasing both cardiac output and peripheral resistance, we are also going to decrease mean arterial pressure.
Carotid artery stenosis. The plaque can be stable and asymptomatic, or it can be a source of embolization. Emboli break off from the plaque and travel through the circulation to blood vessels in the brain. As the vessel gets smaller, they can lodge in the vessel wall and restrict blood flow to part of the brain which that vessel supplies. This ischemia can either be temporary, yielding a transient ischemic attack, or permanent, resulting in a thromboembolic stroke.
Hello, I'm Dr. John Eit, and this is a Society for Vascular Surgery briefing about carotid stenosis and what it means. The detection and treatment of carotid artery disease for the prevention of stroke is one of the most effective treatments in all of medicine. The decision to perform carotid endarterectomy must be individualized and take into consideration a complex set of factors, including the degree of stenosis, the composition of the plaque, the nature and frequency of symptoms, as well as medical and anatomical factors related to the safe performance of endarterectomy. Vascular surgeons are uniquely trained to provide comprehensive evaluation to the patient with carotid artery stenosis and to choose the best treatment for each individual patient. There are two carotid arteries in the neck that provide much of the blood supply to the brain. Just behind the angle of the jaw, the main carotid artery divides into an external branch that goes to the face and an internal branch that goes to the brain. Hardening of the carotid arteries, or so-called arteriosclerosis, results from the accumulation of fatty debris that results in narrowing of the internal carotid artery. Atherosclerotic debris consists of inflammatory cells, lipid, calcium, and platelets. Stenosis is the medical term that is used to describe narrowing of the inside of the artery, and this narrowing is classified according to the percentage reduction in the normal artery diameter. In general, the more severe the degree of stenosis or narrowing, the more likely that a stroke may occur. Stenosis of the carotid artery can interfere with the normal supply of blood to the brain by either of two mechanisms. In some very severe cases, carotid artery stenosis can reduce the total amount of blood to the brain. More commonly, debris can break off and travel to the brain in a process called embolism. Embolism may be clinically silent or result in temporary or permanent neurological symptoms. Antiplatelet medicines like aspirin or Plavix are helpful in preventing the first step in the formation of embolic material. A temporary neurological symptom, like weakness, trouble with speech, or visual disturbance, that lasts for less than 24 hours is called a transient ischemic attack, or TIA. This results when the embolus dissolves and the injured area of the brain recovers. A stroke defines a more prolonged deficit, where the blood flow to that area of the brain is lost and the affected brain cells die. There are 4 symptoms that may warn of an impending stroke, and these symptoms may disappear in a few minutes. Loss in the ability to move the arm or leg or both, alteration in sensation or feeling, loss of vision in one eye, and finally interference with the ability to speak or to understand what is being said.